You are watching this because you are likely in pain and you have been told that your last resort is a spinal fusion. You have been told that a segment of your spine is the problem, that it needs to be stabilized, and that by welding it together, you will find relief. I am Dr. Gurpreet Singh Pada. For over 30 years, I have practiced anesthesiology, interventional pain, and metabolic health. I own and operate medical centers, but I reject the model that dominates this field. I do not believe in assembly line procedures. I do not believe in masking signals. And most importantly, I do not believe in structural surgeries that effectively guarantee the next surgery. We need to talk about the adjacent segment trap. This is a concept well documented in orthopedic literature, yet rarely explained to patients. When you undergo a spinal fusion, you take a motion segment designed to dissipate force and turn it into a rigid block. You fix one level, but in doing so, you destroy the levels above and below it because that mechanical stress has to go somewhere. It transfers to the adjacent segments, accelerating their degeneration and ensuring that the patient will return to the operating table. This is not a cure. This is a structural pivot. If we don't fix the underlying biological terrain, why expect the body to maintain the next segment? Let us look at the biomechanics. This is not my opinion. This is clinical reality. You eliminate natural motion at that segment. A research published in JBJS shows the incidence of symptomatic adjacent segment degeneration following fusion is significant. It's a biological fact. When you weld a segment, you increase the intradiscal pressure and kinematic stress on the segments immediately adjacent to the fusion. Nature built your spine to dissipate force through motion. Fusion forces your spine to dissipate force through rigidity. The surgeon says it's a success because the hardware is in place. But look at the biomechanics later. We see adjacent discs collapsing. We see facet joints hypertrophy. It is a cascade. It is an assembly line of recurring surgical revenue. We are treating the effect and ignoring the system. The adjacent segment trap is not just a biomechanical problem. It is a metabolic problem. Our metabolic health dictates our tissue health. Your spinal discs are avascular. They rely on diffusion. They are the first to starve when your metabolic health is dysregulated. If you have elevated blood sugar or insulin resistance, your body is in a catabolic state. It is breaking down tissue faster than it can build it. When you fuse a spine, you ignore that your terrain is catabolic. You weld the bone, but leave the starving environment exactly as it was. We shift the terrain from catabolic breakdown to anabolic repair. This is what we do at Regan.md. We perform the metabolic audit. We optimize your systemic environment using diet, targeted nutraceuticals, and metabolic modulation to revitalize the tissue. We use precision, imaging-guided orthobiologics to target the disc and facet joints. We are initiating a repair signal within the nucleus pulposus. We address the hidden source of your pain. We are preserving motion, maintaining natural load distribution, and respecting your anatomy. This is an analytical strike. It requires your commitment. I perform procedures for patients who understand the cost of structural loss. The surgeon is trained to remove and fuse. They are not trained in biological restoration. Surgery is irreversible. Restoration is a managed process. Go to region.md, request your evaluation. Stop looking for a welder and start looking for a master builder. Let us determine if you are ready to heal.